Okay, I'm going to go ahead and call the September 24th meeting to order and ask everyone to please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Roll call, please.
Trustee Saturn.
Present.
Trustee Narodowski.
Present.
Trustee Graffia.
Present.
Trustee Keenly.
Present.
And Supervisor Sweeney.
Present. Okay, public comment? Anybody? Yes, sir. Go ahead, right up to the podium. If you could just state your name for the record, and then the floor is yours.
All right. My name is Jordan Friedman. I'm the Executive Director of Hands on Suburban Chicago. And I communicated with some of you, or hopefully all of you, via email. I know today that you might be taking another vote on allocating funding for our organization. For those of you that don't know, I submitted our grant for funding for our organization, and unfortunately it wasn't received. And I found out about it kind of late in the game, and the minute I did, I reached out. But at that point, it was kind of too late. So I'm hoping you'll reconsider. We've been longtime supporters of Elk Grove Township in terms of supporting the citizens here, and we do a lot of great work, and that funding is really important for us to continue to do that. So that's all I have to say.
Thank you so much. Appreciate it. Yes, ma'am.
Melissa Kayer. I was wondering if Elk Grove Township could put their website address on the itemized property tax bill.
We don't handle the property tax bills. That would be Cook County.
Okay, thank you.
Thank you. Okay, any other public comment? Okay, consent agenda. Anybody on the board, would anybody like to remove anything from the consent agenda?
No.
Okay, all right, I'll make a motion to approve the consent agenda. Is there a second?
So moved.
Or seconded?
Or second. I'll move.
Seconded by trustee Ingraffia. Discussion? Okay, roll call, please.
Trustee Saturn.
Aye.
Trustee Narodowski.
Aye.
Trustee Graffia.
Aye.
Trustee Keenly.
Aye.
Supervisor Sweeney.
Aye. Okay, item E on the agenda, the minutes from April 27th. I believe trustee Saturn had just a minor correction.
Yeah, just on section 3, public comment, B, Lynn Cerencioni, who's actually here tonight, but I should say she's a resident of Branagars.
All right. Any other changes, questions? All right, with that change, I'll make a motion to approve the minutes from August 27th. Is there a second?
As amended.
As amended, yes.
Second.
Seconded by trustee Saturn. Any further discussion? Okay, all those in favor, please say aye. Aye. Opposed? Motion carries. All right. F, presentations. Mike from Alliant Mesirow is here to talk about the everything health insurance related. Thanks, Mike.
Hi, everybody. I'm Michael Balin. I'm with Alliant Mesirow. And I'm here to talk about the Elk Grove Township Group Medical Insurance Renewal, which is going to go into effect on December 1st, 2018. So maybe to start off, to kind of give you an idea of what we're going to talk about today. So to begin, I'd like to talk about a little bit of benchmarking data. So we take Elk Grove's plans and rates and we compare it to what we see are the industry averages. So with
Elk Grove Township, right?
Elk Grove,
Elk Grove Village.
Elk Grove Township, pardon me. And then we compare it to other government entities, similar sized employers, and then also employers in the Midwest. And then after that, we'll go into the actual numbers behind the renewal. This year, which is pretty good news, the rates are actually going down. And in previous years, I know that wasn't the case. So we're dealing with an initial decrease. We'll talk about competitive rates from different carriers. So the incumbent carrier right now is Blue Cross Blue Shield of Illinois. We'll talk about a competitive quote from United Healthcare. And then to finish, we'll talk about a voluntary vision quote from a carrier called VSP. So vision insurance is not a group program that Elk Grove Township currently offers, but you guys can, and we'll get into that kind of towards the end of the presentation. So to begin, if the trustees will open their insurance packet here with the neon cover, and you flip to tab 5. So this begins the benchmarking data that we put together. So if it looks familiar, it is. It's the same survey and same data that we used at last year's meeting. We just updated the numbers for this year. So if you flip to page 2 of tab 5, you'll see a slide that says average annual active medical cost per employee. So what this slide is we take the total billed premium and we divide it by how many employees are on that specific plan. Elk Grove Township has 3 plans, so we outlined the 3 towards the bottom. So you got your silver PPO, gold PPO, and blue choice options PPO. And then you'll see what those numbers are compared to benchmarks. The gold PPO, which is that kind of turquoise color, you see that one's the lowest. And that's the lowest because all the employees on that plan aren't covering any family members. So when you cover a spouse or children, total premium goes up, so the average annual medical cost goes up. Taking a look at this slide, nothing is really completely different from benchmarks that we're seeing. So it varies between 12,800 to 9,000 per employee. Page 3 talks about dependent coverage. So the percent of employees with dependent coverage for Elk Grove, it's 27.8%. It's a little bit lower than industry averages. I think Elk Grove's program is very competitive. We're just seeing a little bit lower dependent participation versus benchmarks. Moving to page 5, now we get into more details of deductible levels and premium levels. So page 5 talks about the monthly employee share as a percentage of total premium. So on the left side you'll see single, on the right side you'll see family. So for single, depending on which plan an employee takes, they either pay 15% of that employee-only premium or they pay 5%. For family, we had to do a little bit of rounding here because Elk Grove covers 50% of the additional cost to cover family members, which doesn't necessarily mean that they're covering 50% of all that premium. So when you take into account the single contribution and the 50% of additional premium for family members, it averages out to about 33%. So, and that's universal across all 3 plans that Elk Grove offers.
Where it says government, that's all government employees in the Midwest?
Government employees actually nationwide.
Okay.
Yeah. So on that government, on the light blue, that's 16%. So Elk Grove is a little bit above that. Moving on to page 6. So this talks about deductible levels. So Elk Grove's deductible levels vary for an individual from $3,500 to $4,500. That's a little bit above benchmarks, but what this doesn't take into account is the employer HSA money. So you'll see that, especially for family, Elk Grove's deductible levels are a lot higher, but when you take into account employer seed money for the HSA, that brings it a little bit further down, closer to benchmarks. Median coinsurance, so this is the percent that the carrier picks up once or if somebody hits their deductible. So that varies from 100% down to 80%. And for out-of-network, it varies from 100% down to 60%. And feel free to interrupt me if I'm going too quickly here, so I know there's a lot of information on these slides.
Mike, did you get an extra one of these?
I think I do. Is there maybe one in that seat over there?
Here. I'll share with George. It's fine.
That's okay.
No, that's fine. That's fine. Just,
Agency contribution, that's not, doesn't have any effect here, it's just.
yeah, no, both.
Both, okay.
It's just more here. We just give more money for the family.
It'll be the same for,
All right, so kind of going back to page 8 here. So this is the out-of-pocket maximum. So this is the most money that an employee would pay out of his or her own pocket in a given calendar year. So for a single, that varies from $4,000 to $6,450. Then for family, you'll see it varies between $12,000 and $12,900. But again, this does not take into account the employer money that goes into employees' HSA accounts. So kind of, before we get into the financials and the specifics of each plan, and we want to show you guys benchmarking data, so I can sit here and say, you guys are competitive, you're not competitive, other employers are doing this, other employers are doing that. But I think this is valuable and tangible data that you guys can use as you decide on what the best course is for the township. So tab 6. So this gets into the financials, shows plan design, and then total billed premium. And the way that we illustrated this, and it's kind of funky, it's a fold out here, but trying to get all this on 11 by 18 or 8 by 11 is tough. I would need glasses. So, but the left-hand column, this is current. So this shows what the current plan designs are and what current enrollment is based on each plan. So you got 5 people on plan 1, you got 5 employees on plan 2, and then 8 employees on plan 3. The right-hand column is the renewal. So anything that's bolded in blue is a benefit enhancement. Anything in bold and in red is a benefit decrease from the current program.
How do you decide where to increase or decrease?
So this is actually Blue Cross's decision. So every year in the small group market, and the small group market is any employer between 1 employee and 50 employees, their portfolio of products changes. So from 17 to 18, so the 17 plan designs are not offered in 18, and they reevaluate, frankly, pretty much everything. So the plans are similar, they are not identical. Also, as in years past, Blue Cross gives the township the ability to decide on how you guys would like to be billed. So currently, it's an age-banded billing structure. So younger employees have less expensive premiums, older employees are charged more expensive premiums. That's why the numbers vary so much on the age-rated renewal column. Composite renewal is they take your existing age-banded rates and they come up with a blended average, which is called a composite. So for total cost, it adds up to about the same number. It varies a little bit. So the age-rated renewal is a minus 6.11% decrease. The composite renewal is a minus 7.59% decrease. But the effect per employee differs greatly on a composite renewal. So your younger people, their rates are going to skyrocket. Some of your older employees, their rates are going to go down.
And we had age rated for 2018?
Correct. So current is age banded. Yep. So kind of getting into the specific plans. So, Plan 1 renewal. So this is Plan G535 PPO Gold. So this has an in-network individual deductible of $2,700, a family deductible of $8,100. There's actually a small typo here, so that 5,500 number, which is the out-of-network individual deductible, that should actually read 5,400, not 5,500. I apologize, that's a typo on our part. But I'll fix that and send the revised financials tomorrow. Then it's 80% coinsurance after the deductible to an out-of-pocket individual maximum of $5,000. So compared to current, the deductible is less, so $2,700 is less than $4,000, but the out-of-pocket goes up, so it's $5,000 instead of $4,000. This is still a high deductible plan. It's a HSA plan. You can see that where it says deductible and coinsurance for office visit and prescription drugs. So that's one really unique characteristic of a high deductible HSA plan, is that there are no copays. So a standard PPO program, it would be a $20 copay to see a doctor or a $30 copay to see a doctor. On a high deductible plan, you pay what's called a discounted retail price of it. So if retail, let's say, is $200 to see a primary care doctor, you'd get an in-network discount with Blue Cross. Maybe that goes down to $120, $130, but that would be the amount that the employee would pay to see that doctor, but that would all go towards the deductible. Kind of moving down, Plan 2. So this is Plan S534 PPO Silver. So this plan actually is pretty similar to the current Plan 1. So it's a 100% plan. The deductible is $4,800 for an individual in network, and it's $13,100 for a family in network. Like I said before, this is very similar to the current Plan 1, just the deductible levels vary a little bit. And then for Plan 3, so this is what's called a Blue Options product. So in 2017, the Township decided to offer what's called a Blue Options product. So what this is, it's a tiered network approach. So with a regular PPO HSA plan, you have your in-network benefits, then you have your out-of-network benefits. With Blue Choice Options, you have two networks that the employee can choose from. So you have Blue Choice, which is a smaller local Chicagoland network. Then you have your PPO network, and then you have your out-of-network benefits. So it's kind of an added layer that's a little bit different than Plan 1 and Plan 2. This plan, pricing-wise, received the biggest decrease, but it's also for a reason. So the Blue Choice deductible currently on this plan is $2,800. The renewal is $4,000. So that's a pretty dramatic difference, which is an input and a reason to why the pricing is going down as much as it is for this Plan 3. Then towards the bottom, the bottom half of this sheet shows the rates, current, age-banded, composite renewal. We outlined it per person that's on the plan currently. We kept it anonymous, but there's 18 total Elk Grove employees on the plan now. That could change during open enrollment, but it's been pretty steady for the past 3-4 years, hovering right around between 16 and 20.
HSA, right, isn't it?
They were all HSA plans.
So does anybody have any questions for me? So this renewal, so basically if you guys just said, we're good with 6%, we don't want to change anything, this is what the program would look like. Okay. And flipping to the next page. So this is option 1.
Can I just ask a question?
Sure.
If, say, all the employees decided they didn't want to go to this, like all the people that were in this third plan, and they said, well, I want to go back up to the second plan, so that my deductibles won't be so high, or, would that then, their rates would go up, then, wouldn't it? So the bottom line would kind of go up?
Correct.
So this is only if everyone stays
Exactly.
Okay.
Exactly. So the premiums that we're showing here, this assumes that nobody moves between plans.
Okay.
And during open enrollment, that very well could and probably will happen. So it's not a finite number. It could change a little bit, but
Okay.
correct, Erica. Yep. Moving to the next sheet here. So this is what we're calling option 1. So this option here brings that decrease down even further. So for the renewal, it was a minus 6.11%. Here, it's a minus 8.33%, or an annual savings of about $17,000. And what we did here was we eliminated a plan. So for option 1, we replaced that gold PPO plan option and replaced with that silver S534. So there's really only 2 plans on this renewal sheet. So plan 1 and plan 2 are both the same plan here. And then you have the blue options plan towards the bottom. Does that make sense? I don't know if I explained that very well. Okay. So plan 1 and plan 2, both 100% plans with an individual deductible of $4,800. And then you have your blue options, blue choice options, plan towards the bottom.
Yeah, so this is, and that's the same as here.
So before I got into, or get into a quote from United Healthcare, does anybody have any questions for me, or want me to go through any other details of the Blue Cross options?
I was just wondering, I'm surprised rates have gone down. Is there a reason you know of for that?
I don't want to say I'm surprised. I think it's about time. So I was talking about this, a little bit before the meeting started as to why rates are going down. And full disclosure, I think this is kind of my opinion here, but so healthcare reform was passed in the spring of 2010. And a staple of the Affordable Care Act was, or is called community rating for individuals and small employers. And what that means is that any health insurance carrier, Blue Cross, United, whoever, they can't individually underwrite people on the individual market or on the small group market. So you could have all the claims in the world. You could never go to the doctor. Your rate would be the same, assuming you're the same age. So going into that, and going into that system, the carriers, Blue Cross in particular, they were going in relatively blind because they couldn't underwrite risks and they couldn't underwrite groups anymore. So when they came out with their initial rates, they thought that was a reasonable level to justify the claims that they pay. Well, going into 2011, 2012, and 13, their claims were significantly higher than the premium dollars they were bringing in for a variety of reasons. And over time, that's why other townships, other private sector employers that are under 50 employees in that small group market have had to absorb some pretty significant increases. Well, now it's 2018, almost 2019, and I think with that large enough sample size, 8-9 years of experience, carriers just have a better idea as to what their risk actually is. They know what's on the books, they know which groups are staying, they don't know, but they have an idea of how many groups are staying, how many groups are leaving, and I think their underwriters and their actuaries just have a better idea as to what the risk actually is. And then this year, I think they were able to come to the conclusion that we're overcharging a little bit. We can decrease our rates. We can bring down rates for our individuals or our small employers. So I think that's the biggest factor going into it.
Awesome.
Now, I hope that trend continues, and it's not a one-time holiday or however people want to call it. But so another, in addition to Blue Cross, so Blue Cross is not the only health insurance carrier out there for smaller employers. So we got a quote from United Healthcare. So we actually looked at 3 other carriers. We looked at Humana, and we looked at Aetna. Both Humana and Aetna, they are very uncompetitive. So they are drastically higher than the Blue Cross current and the Blue Cross renewal rates. So they're not in this packet. But United Healthcare is competitive. Now they differ a little bit from Blue Cross, but they're in the ballpark. So if you look at this quote, I think the general theme here with United Healthcare is they are more expensive with Blue Cross, but the plans that they offer have lower deductibles for the employees. So Plan 1 with United Healthcare, so AUGU, I don't know why they call it that, but they do. This has a $2,000 deductible, 100% plan, and a $4,500 out-of-pocket after that. So you'll see here, that, deductible is less than current. Out-of-pocket is higher, but not drastically higher. Another difference on this plan is that for prescription drugs, copays, which I said don't exist, they will actually kick in once the deductible is hit. So if someone were on this plan and they hit their $2,000 deductible, they go and pick up a generic prescription. Instead of paying the full cost of that script, it would be a $15 copay. And that kind of structure would exist until the out-of-pocket of $4,500 is met. So it's a little bit different than how Blue Cross does it.
Then what happens once that's met? Are the
So then-
prescription drugs,
Covered at 100%, yeah. So it's the same way with Blue Cross too. So if someone were to hit their out-of-pocket maximum, Blue Cross comes in and picks up everything at 100%. The employee would just have to, pay their premium every check or every month.
Can I ask a question?
Sure.
So the first plan on the United, it says that it's, like the individual deductible is 2,000 and then it's covered at 100%. So why does the out-of-pocket still have another $2,500?
So that's for the additional cost of the prescription copays.
So that's, okay.
Yeah. But you're right, but for, not prescription claims, so imaging, inpatient, outpatient, stuff like that, once that deductible is hit, UHC would cover it at 100%.
Last year, you mentioned that sometimes with United Healthcare, it takes longer to get approval for procedures and things like that.
I mean, I think that exists with any carrier, Blue Cross, United, whoever. Our experience has been that United Healthcare is just a little bit slower in that process. Not to say that they don't do it, and United Healthcare is a very quality, health insurance carrier in the market. But that has been our experience. So whether it's a prior authorization for a medication or for a procedure, Blue Cross is their reputation is they do it quicker. They process claims quicker. Blue Cross has their issues too. That's been our experience with it. And then moving down to Plan Design 2. So this plan, it's not a 100% plan. It's a $2,700 individual in-network deductible, and then a out-of-pocket of $6,550. So higher deductible, co-insurance is less than Plan 1. So this is going to be a cheaper plan than Plan 1. And then for Plan Design 3, well, actually, before I get into that, so both Plan 1 and Plan 2 with United Healthcare, both these plans utilize their nationwide PPO network. So Blue Cross calls it PPO, United Healthcare calls it Choice Plus. Both networks are very, very, very similar. I can't say they're identical, but both have plenty of physicians locally, statewide, nationwide. Plan 3 is different. So Plan 3 utilizes a smaller network. It's called Core. So Core is similar to the Blue Choice network with Blue Cross. Now with this Core plan, it's only Core. So it's not a tiered network approach, it's only Core. So an example of excluded hospitals in Core would be Lurie Children's, Northwestern Memorial, Rush, University of Chicago. So these are, PPO hospitals or Choice Plus hospitals. They are not Blue Choice hospitals and they're not Core hospitals. So kind of a general rule of thumb is, bigger teaching facilities, they're part of the nationwide networks, they're not part of the local Chicagoland networks like a Core or like a Blue Choice.
So, but in the Blue Choice, you could go to the second option and go to the PPO, it just doesn't matter as much.
Correct.
But the core, they're not.
It's Core or exactly. So it's a nice feature, I think, of the Blue Choice Options program, is that you can go to Blue Choice, your benefits are better, but you don't have to. You can still go to PPO doctors and hospitals, just to pay more for it. So the deductibles are higher, cost sharing is higher. But you're right, Erica, so with this Core plan, it's Core or you're out of network. So from a billing standpoint, so just like with Blue Cross, with United Healthcare, you can choose how you'd like to be billed, whether it's composite or age banded. And then looking at the age rated portion of it, you'll see the rates are a little bit above current. So a 0.61% increase above current. So actually, one thing I forgot to mention earlier, I know in our past discussions, timelines for making decisions has always been a little bit tight. So that's not the case this year. So the deadline with Blue Cross, for an example, to make decisions is November 1st. So the board does not need to make a decision tonight. We can discuss it tonight and then use the October meeting as a way to finalize decisions. But you guys don't have to do it tonight. I know in the past I've said you guys got to make a decision in 5 minutes. You don't need to do that.
Is it the same for United?
So United probably have a little bit more time. So if Elk Grove were to go to United, we probably have an additional week to make that decision. But if we were to change carriers, there's a little bit more to it. So we would need to submit to United. We need to get employer paperwork involved. It's a little bit more of a process. But yes, early November would be a good time frame to make a decision about United.
Okay, any questions for Mike?
So on the Blue Cross Blue Shield, just so I understand, the coverage is less robust, but the price is down than current? I mean, it's less robust than the past?
Correct.
Okay. But the price has come down as a result of that as well, too?
Correct. I mean, as a generality, I think
Yeah,
that's true.
yeah.
I mean, there's variability between the plans. Some deductibles actually do go down with Blue Cross, but as an overall kind of general picture, yes.
Okay.
Any other questions for Mike? Okay. Thanks, Mike.
You're gonna take that vision?
Yeah. So.
Oh, yeah, okay,
Yeah. So
go
there's a
ahead, yeah.
couple other. I promise I'll be quiet soon, Mike. The last couple of sheets here after the United Healthcare quote, these talk about the contributions, so employer, employee, and total dollars for the township. So this first page here with Elk Grove's logo on there, this talks about the current HSA contributions, which are an annual number per employee, depending on which plan you're on and whether you're covering family members or not. And the bottom shows the percentage split for the 3 current plans. And then the sheet after that just drills it down a little bit further. So here we get into, instead of just percentages, we start talking about total dollars. So the top half shows what is current or what became effective December 1 of 17. And then the bottom half assumes Elk Grove takes the renewal at the 6% decrease, and it shows total dollars, total township dollars, and then total employee contribution dollars. So we thought that would just be a little bit helpful. Instead of just talking percentages, it shows total dollars as well. And then lastly, tab 7 So this is the voluntary vision quote that I alluded to earlier. So vision insurance or group vision insurance is not a benefit that Elk Grove Township currently offers. Blue Cross does have a vision discount program embedded into all 3 of their medical plans, but it's not formal insurance. So with Blue Cross, you get a discount on exams or materials, but it's not all that robust of a benefit. Doing a group vision program would offer a more robust benefit. So the carrier we quoted here is called Vision Service Plan, or VSP. And we quoted this on a voluntary basis. And what voluntary means is that this would be an entirely employee-paid benefit, so the township wouldn't contribute any dollars towards this plan. And then employees can either say yes or say no. It's entirely voluntary. One caveat before I get into what the plan actually is that to be able to do it, to be able to write the coverage, VSP requires 10 employees to sign up. So that potentially could be an issue depending on what kind of participation we get with the township. But I think offering vision, I think it's a good way of boosting the benefits program in a cost-effective manner. So what do you get with a vision plan? So with any vision program, VSP included, you get a benefit on exams and you get a benefit on materials. So to get a vision exam on this VSP program would be a $10 copay. So a vision exam without insurance could easily be $100, $120, $130.
How much of that embedded Blue Cross vision would they pick up on that? Depends.
Yeah, it depends on the provider, but it's usually about a 20% discount. And that might even be a little high.
We have this with the school districts, it's well worth it
Yeah.
for the cost.
So the way I like to think of it is that if you're on any vision program and you get an exam once a year, that almost pays for the program itself, and we're not even talking about contact lenses or glasses yet. Then below that, you'll see what the benefit is for frames, lenses, and contact lenses. So for lenses, it's a $25 copay. You can get lenses once a year. You can do an exam once a year. For frames, it's a $130 allowance. So instead of a copay for frames, VSP would cover up to $130, and then you'd get a 20% discount off of any balance above that. You can do frames every 2 years. This plan could be modified to get frames every year, but that would increase the premium. And the contact lens benefit is below. So similar to frames, it's a $130 allowance. And kind of one thing to keep in mind is that the contact lens benefit is not in addition to lenses. It's one or the other. Then
Frames?
frames too, yeah. So it's glasses or contact lenses, yeah. And then towards the bottom, you'll see what the monthly premium is. So $1091, call it $11 for employee only. To cover a family, it's $28, $29.
Anything else, Mike?
That is it.
Any questions for Mike?
Thank you.
Thanks, Mike.
Thank you.
Moving on to reports. Connie, Assessor's report.
Well, you've received my written report, and I'm sure that you'll note that the numbers that we dealt with in the last Board of Review session were substantial. Other than what I have given you in my formal report, I am happy to report that as of today, our entire digitization program is complete. And I want to take this opportunity to thank my staff, Lori, Brian, and Annette, for a superlative job and wonderful I'm trying to think of the word, but their attitude during this whole thing has been remarkable, not only dealing with the project, but dealing with Board of Review at the same time. So my hat's off to them. Any questions?
It's a very good job by everybody. I was very impressed. Yep. I think it's about 3 weeks ahead of schedule, I think.
3 weeks
Yeah.
ahead of schedule.
Very good. Thank you. Clerk's report, George.
You have the written report, and there's nothing really else extra to say.
All right, any questions for George? Okay. Highways Commissioners report, Art.
Giving an update on our road construction, we've had some setbacks with the Village of Elk Grove, with their engineering department. They weren't too happy with our plans for our stormwater drainage going into theirs, which currently does. Mark, our engineer, and the village engineers have been hammering out details regarding restrictors and that type of thing. And it basically does a domino effect, because whatever happens has to go back through the contracts, through the contractors, and through everybody else, and start all over again. So hopefully we're getting near the end this week. Most of the areas where constructions will begin, they've marked off all the utilities, the pipelines, and everything else. So we hopefully try to get this going this week, I hope. Any questions?
Okay. Thanks, Art. Okay, I'll make a motion to accept the Township elected officials report. Is there a second? Seconded by Trustee Saturn. Any further discussion? All those in favor, please say aye.
Aye.
Aye. Opposed? Motion carries. No correspondence. Okay, 2 items under old business. Sent out just a reminder about these 2 items based on new rules for governing board meetings. Any item under new business that doesn't receive 4 or more votes on first reading moves to a second reading automatically the following month. Item 1 under old business, funded agency request, hands-on suburban Chicago. The motion passed on a 3-2 vote for funding for $5,000. So leave it open for anybody to take action.
Is that the motion then?
The motion is to approve no, I'm not making the motion, I'm saying last month's motion,
What
I'm just
asking-
reminding everybody, it
what
was
I'm asking is
5,000, the motion last,
Motion.
Do we
Right.
make a new motion?
yes,
Okay.
so it would be, yep, you just gotta do it twice, so.
Well, I guess we all got the email that said they're gonna use certified mail from now on. So I will make a motion again to fund them for $5,000.
Okay, a motion has been made by Trustee Saturn to fund the Hands-on Suburban Chicago in the amount of $5,000. Is there a second?
I'll second it.
Seconded by Trustee Nuredowski. Any further discussion?
I would caution all of us on this, with no disrespect, I'm sure that you sent it in. If there was anything that I could put my hands on that said, boy, we messed it up, I would certainly vote for it. I don't want to penalize anybody. My big concern is that if you do it now, there are unscrupulous people out there who may come at us later, and since it's my theory that we never really get out of junior high, it'll be, well, you did it for them, why aren't you going to do it for us? So my vote's going to stand for that particular reason.
Well, and last month, we talked about writing a policy for this happening down the road. And, you know, they are somebody who we supported before. I mean, I would hope nobody new would come in and say such a thing, but that is a very good point.
Any further discussion? Roll call, please.
Trustee Saturn,
Aye.
Trustee Nuredowski,
Aye.
Trustee Graffia,
No.
Trustee Keenly,
Aye.
and Supervisor Sweeney.
No. Okay, item 2, same thing, the motion to create the full-time food pantry operations manager passed on a 3-2 margin last month. We've had 4 weeks to, hopefully everyone's had a chance to get any information or ask any questions they had. So based on that, I'm going to make a motion to create the position of full-time food pantry operations manager.
Second.
Seconded by trustee Ingraffia. Any further discussion?
I just have a question, because I can't put my fingers on that email you sent me, Mike. It's open Monday, Tuesday, Thursday from,
9 to 3:45. Mhm. Any further discussion? Roll call, please.
Trustee Saturn,
no,
trustee Narodowski,
Aye.
trustee Ingraffia,
Aye.
trustee Keenly,
Aye.
Supervisor Sweeney.
Aye. Okay. Motion passes. Okay, under new business, okay, we have 3 elected officials that have requested approval to travel down to Toy in November. Myself, Clerk George Bussey, and trustee Keenly. So I'm going to go ahead and make a motion to approve elected officials' travel to Toy, to the Toy Education Conference in November. Is there a second?
I'll second it.
Seconded by trustee Ingraffia. Okay, any further discussion? Roll call, please.
Trustee Saturn,
aye.
trustee Narodowski,
Aye.
trustee Ingraffia,
Aye.
trustee Keenly,
Aye.
Supervisor Sweeney.
Aye. Okay, motion carries. All right, 2019 health insurance, in the packet, I asked Paul to include my recommendation moving forward. Like Mike said, I think we were given a gift with actually having some time. You know, I did talk to Michael Balin a couple times. I still have some additional questions. That's just me. You know, and last year, and Erica and I were looking at trends and what we've been spending, right? I just want some time to review trends in this, so I'm actually, I'm kind of put out a request that we don't really have to table this, but we can schedule maybe a committee of the whole meeting or two, hammer out some of the details and really dig into some of this in that kind of setting. I think that will help us come back in October with a game plan to vote on then. That gives us time to ask Michael Balin more questions, for everyone to sleep on it and kind of think about where they want to go. But that's just my suggestion, but I'll open it up to the floor.
So you want to table it for further discussion?
Yeah, I mean, we can table it to October. Here,
Or do you want,
I mean, either way, we can
Schedule some
we can just move it to, I mean, we can table it to make it official, but just keep in mind, I mean, the only catch is that it would have to have 4 votes in October to pass on first reading. I think we can get there. I think that's by committee of the whole, right? I mean, I think this is, by and large, I think the board, through all our disagreements, I think health insurance, I think we might disagree on some points here and there, but on the whole, I think we can come to an understanding. I'm hopeful that we can, so.
Well, if you have a 3-2 vote or something. you
If
can
we have a
still-
3-2 vote, we could still schedule a special, we
yeah.
could schedule a special meeting to vote again, absolutely.
Do we want to pick a date tonight, or you want to send us some dates by
Oh, yeah,
email?
Paul will send you some dates. Yep,
Okay.
Okay.
Sounds
then we'll
good.
have committee of the whole meetings.
yep, that'd be great.
Or meeting.
Okay. So we'll just make it official. I'll make a motion to table a 2019 health insurance to our October meeting. Is there a second?
Second.
Seconded by trustee Saturn. Any discussion? All those in favor, please say aye.
Aye.
Opposed? Motion carries. Okay, office closing, item 3, office closing dates for remainder of calendar year 2018. Several months ago, trustee Saturn had brought that up, requesting, I believe, I don't want to put words in your mouth, but requesting adding New Year's Eve onto the current year, calendar year, days off, office closing, right? Is that correct?
Yeah.
Okay. All right.
I'll make a motion. I'd like to add New Year's Eve, December 31st, 2018, to our list of closing dates.
Okay, a motion's been made to add New Year's Eve onto the 2018 as a office closing date for calendar year 2018. Is there a second?
I'll second it.
All right, trustee Nuredowski seconds it. Any further discussion? Roll call, please.
Trustee Saturn,
Aye.
trustee Nuredowski,
Aye.
trustee Graffia,
No.
trustee Keenly,
No.
Supervisor Sweeney.
No.
That's
Okay,
3-2.
motion fails. Okay, all right, item 4, ordinance 2018-06, office closing dates for calendar year 2019. I had sent out a memo about my proposal. I did take some time to just let everyone know, I did take some time to review and think about the email that trustee Ingraffia sent. I hope everyone, I forwarded it yesterday to everybody. There was 2 dates in there that I felt that I could get on board with, being President's Day and Veterans Day. I still believe Columbus Day should be our office should be open. So what I'm doing is I am, for calendar year 2019, I am making the motion to approve the office closing dates for days to include New Year's Day, President's Day, Memorial Day, Independence Day, Labor Day, Veterans Day, Thanksgiving Day, the day after Thanksgiving. The office will be open from 9 to 1 on Christmas Eve, and then Christmas Day off. Our office closed. Is there a second?
I second.
All right, seconded by trustee Keenly. Any further discussion?
I would like consideration for Veterans Day. It is a federal holiday. Most,
Yeah,
if not,
that was included in my
Columbus
list.
Day was the
Okay.
day he didn't want to,
Columbus
I'm sorry,
Day,
Columbus Day?
Yeah.
I'm sorry, Columbus Day, it's a federal, I'm sorry. It's a federal holiday. There's no mail delivery on that day. The bigger agencies, the county, the city, and so forth are closed on that day. I couldn't make head or tail out of our local municipalities' calendars. Someone's gonna have to walk me through those. I don't know when they're closed.
Well-
And I think it's more, there's less of an expectation that the office would be open on that particular day.
okay.
yeah.
Any other
Also, it's-
discussion?
It's a state holiday, and Palatine, Schaumburg, Barrington, Oak Park, Northfield, Niles, Leiden, they're all closed on Columbus Day too. The other thing is, Connie, is there an issue with Cook County with Assessor's
There's not been an
office?
issue. Obviously, the county is closed on many more days than we are. However, what they tend to do during those times is they update their computer system, and therefore we do not have access to data. So most people assume if the county's closed, we're closed. But if they do come in and we don't have access to data, they're gonna have to come back anyway.
Yeah, I'd like.
If that's the only issue, I'll amend my motion to include Columbus Day as an additional office closing day. Okay, is there a second on that?
I'll second it.
Seconded by trustee Ingraffia. Any further discussion?
So then the dates would be New Year's Day, President's Day, Memorial Day, Independence Day, Labor Day, Columbus Day, Veterans Day, Thanksgiving, the Friday after, closed, Christmas Eve,
Christmas Eve would,
at 1 o'clock, and then Christmas itself.
Only Good
That's
Friday
correct.
would be removed.
what's that?
Only Good Friday would be removed.
Good Friday, on this calendar, Good Friday would be removed, and then there would just be, then Christmas Eve closed after 1 o'clock. Okay, any further discussion? Okay, roll call, please.
Trustee Saturn,
Aye.
trustee Nuredowski,
Aye.
trustee Ingraffia,
Aye.
and trustee Keenly,
Aye.
and Supervisor Sweeney.
Aye. Okay, motion carries. Last item on the agenda was just a couple amendments to ordinance 2016-07. It's a ordinance we had already passed in accordance with state law, spelling out what employees, elected officials, get reimbursed for travel, meal, lodging expenses. On, where are we at here? On page 2, well, under section 1, definitions, said meeting, item 5 under, is it under 5? That doesn't make any sense. Oh, I'm sorry, I got my, so travel reimbursement policy, section 2, item 5, is an addition, township employees, officers, and elected officials
Here it is.
will not, for any reason, be reimbursed for alcohol. And then section 4, documentation of expenses, just an amendment that the names and position/organization of any other attendee whose meals are included on the receipt shall be listed in the appropriate area on the standardized form. Okay?
Does that mean if we're going to like a top dinner meeting, we need to,
No. Like if I said, if you were to, for some instance, if you were on like the TAC board or whatever, and you needed to have a special meeting related to that, and you had officers from other townships with you for like a smaller intimate dinner, then you would just have to include them. No, not, yeah, you don't have to get a list of everyone that's at a big conference or whatever. It's just
we
for.
have to estimate ahead of time for you to go to a tech dinner or no?
No, you're, all we're saying is, all this would say is that if you, we just want to know, right? So we can, if someone says, well, who else was at that dinner? We can say, X, Y, this person was there.
You just need to note the individuals who.
Yeah.
Okay.
We don't need, you don't need to justify, I mean, essentially, you're just letting us know who is there. Okay. All right, I'll make a motion to approve those amendments to 2016-07. Is there a second?
So moved.
Moved by trustee Saturn. Any further discussion? Okay. Roll call, please.
Trustee Saturn.
Aye.
Trustee Narodowski.
Aye.
Trustee Graffia.
Aye.
Trustee Keenly.
Aye.
Supervisor Serna.
Aye. Okay, motion carries. All right, no further business on the agenda. Can I have a motion to adjourn?
So moved.
Moved by trustee Saturn. Is there a second? Seconded by trustee Nuredowski. All those in favor, please say aye.
Aye.
Aye, opposed. Motion carries. Thank you very much.